Is it weekend? Is it voucher? To try to give some kind of answers, to where this funding should go. So when you're having these RFPs and this other information going out, what are caregivers looking for? Are they looking to hire somebody that they know and trust, that even possibly live in their home, which you can't do right now in Illinois? You can hire a relative, or a family member, but they have to be living outside of your home. So there's a lot of really great questions and data that we hope to gather, and then we're going to share with all of the agencies that have participated in sharing this information. And then we just too decided we're not taking the survey down. We may adjust some of the questions once we see the responses, and that will be something that we can leave on our website. We can make sure that we continue to post through Facebook and other websites to continue to get that caregiver feedback more than just once we send it. So that's something we're working on, and we'll be getting some of that information collected the end of this month. We have a new Illinois Family Caregiver Coalition, and they receive their funding through IDOA. And, they have, so we've been really, partnering with them too, and they've been a really great partner in helping to share and get this information out. Outside of the survey, the survey, the training, and the task force, one thing that we learned from the COVID and the meetings when we would get together was really about that caregiver isolation. So we have a lending library through our grant, the Lifespan Respite Grant, and we have talked to other partners throughout the state to find out how they run their lending library and what works and what doesn't. But we have the iPads, we have the Alexas, and we may also have the virtual reality headsets. We received a call from a nonprofit in Boston who went to our website, and they are ones who will work with other nonprofits, specifically hospitals, to work with cancer patients and burn patients and provide these reality goggles so that that they can go anywhere they want and they can decide where they want to go. So they are willing to write a grant for us to also add that into our lending library. So we're excited about that. I don't know if that's going to be in 2 months, but I think what a great idea to also add these virtual reality goggles, and especially where it could for mobility issues or the very remote issues, to really try to help with some of the isolation. I would say those are the top things that we've kind of started, and that has been a just continuing to work in a work in progress.
I have oh, sorry, Jill. Oh, okay. Oh, you're muted. Tina, I was wondering, how does Alexa app work with your lending library? I can't figure that out. That sounds really great.
So with Alexa, it would really be, providing it to a caregiver as a companion. Okay. Can you, talk to it, ask it questions. So yeah.
So you're in your lending library, you're actually going to lend those out to caregivers.
Yeah. Yes.
Okay, I get it. I was thinking it was like it was be a way for them to be able to listen to trainings or something. So that's a great way to do that. I'll have to remember that one.
And we do, and Dana, yeah, thanks for asking. And we want that too, because we have been, working on getting trainings together, and we would love to really get some type of a calendar and one spot to go to where caregivers, across the lifespan can, gather and hear and listen to these things. So you're right. That's also would be, a hope. Mm-hmm.
That's great.
I was interested in the goggles for the virtual reality. Our virtual reality program for empathy training is going away with our grant ending. And also they went way up in their leasing costs. So that'll go away for us. But I do like the fact that you're saying for their isolation and all that might be something that we could look at adding. I didn't say, which Jill doesn't even know this, but we have the Caregiver Wellness Initiative that was listed for mental health stipends. We have since received, as of this week, a $25,000 grant to expand that for Huntsville families, maybe Madison County. But it is a Huntsville Hospital grant, so it's for our county only. But we're hoping to leverage that. In my meeting next Wednesday, I think it's going to get bumped another week, but we're trying to match and leverage that local grant with a state mental health funding to actually bring a full-time person on board. So not only can we maintain the memorandum of understandings that we have in place for counselors throughout Alabama, if you want to go to somewhere in your hometown in person, or if you don't want anyone in your hometown to know, you can do virtually if we have this person through telepractice. But we are hoping to have not only the full-time counselor familiar with caregiving and disability issues, but then also continue the network of stipend contracts that we have with providers throughout the state. But fingers crossed, Jill, that we get that funding.
Yeah, very exciting.
Not this year, I think it will be next, but I did feel really good, and I think we will be able to maybe start that October, if not sooner.
Well, that's
but
very
the isolation is such an issue. I think that's interesting. Can you share that information with everyone?
I will. You know what? Once I get a little bit more, information, I will be happy to. That's all I kind of know right now is just that conversation that we had, and that they, are looking for a grant to pay for this, to become to make it an opportunity. And they were really excited about the timing of the lending library and then adding this piece in. And
I was going to recommend.
Yeah.
I'm sorry. We've got the animated pets, the cat, dog, and now a bird. So that if you have to mention you remember having a pet, but you can't care for one, they are mechanical enough and they move and purr and have gestures like the animal. And that seems to be very popular, particularly with our Alzheimer's and older clients. But if you're going to do the virtual escape to Greece, I may need to do that just because that's the only way I'm going to travel. But you might want to look at seeing about some of those pets in that same grant.
And you know what? Thank you. Yeah, I remember hearing about that during the pandemic. And actually, I think there was a video. Did you also do a video that showed a caregiver with the mechanical dog? I thought I remembered seeing that.
That was New York State. Did the robotic pets in a big way.
Yeah. Okay. I remember seeing that. Yeah. I just wrote that down. That's a great idea.
I did recently see some research that the virtual headsets were not very successful for people with dementia, but I'm assuming you're talking about virtual headsets for the family caregivers to give them a break. Is that?
Yes.
Yeah. So that's that's really interesting.
Mm-hmm.
Dane, I know you've got a lot going on in Washington State too.
Yeah, you know, we did the pets, the virtual pets, both the cats and the dogs. We used some state family caregiver money and gave the area agencies on aging an opportunity to, order as many as they wanted, up to a certain amount, of course. And they were, in some places, I think they were really well received, and in other places they just didn't go over well. Some people thought it would be kind of deceiving and perhaps even not respectful to, or like you were tricking somebody with dementia. I wasn't one of those people. I think that someone, with advanced dementia could get a lot of, comfort out of that. And I've seen that in actual, I bought a couple of them and gave them to friends whose parents had dementia, and they worked really well. So, and then our developmental disability administration ordered some too for people with IDD or DD, and I think they went better that way. I think they were better. People liked them more for that, I think. But in some cases, and I think it's probably how you present them, how they're presented helps too. So we learned a lot from that. I think we are letting that contract go now, but we did order some, kind of to have on hand. We also use Trualta statewide for any family caregiver who would like to do that. And Trualta is an online source of training, short, like coffee break type training, a few minutes about so many things. And the reason I finally got on board was because it was really the only thing that we have that teaches unpaid family caregivers skills like lifting and, safety skills with taking care of their care receivers. So I liked it for that, because family caregivers don't really, we don't have anything like that. So it has been a slow growth over time, but and anybody from Lifespan Respite is involved, anybody in the state. The problem that I always come up against that I can't seem to convince other people to do is marketing. We have these things, but nobody knows about them. I mean, we serve 1% of our unpaid family caregivers in Washington. And we could do a lot more than that. So, but there's so many issues with caregivers. They don't know they're a caregiver. They don't want to, a lot of people don't want to say they're a caregiver. They don't know what's out there. They don't know what services are. And I always feel like everything we do, we have these great things for people, but we need to figure out a way to let them know about them. So that is one thing I wish I had millions of dollars just to do, like a nationwide huge marketing campaign, kind of like the heart disease or, breast cancer. All of the things that have been really, really well known had these huge blasts of marketing. So anyway, that's my number one wish. But I wanted to talk a little about another thing we're doing. We're proposing in our next grant to work with our Washington Cares. It's the first savings account. Really, it's a trust for long-term care, because nothing pays for long-term care. So they're going to start taking money out every month out of every person who works in Washington's wages and set it aside for them for until they're vested. I think it's 10 years now. So it's just the beginning of that, but we wanted to work with them on ways that we could help family caregivers, because there are a lot of those people who are going to be making decisions about how that money is going to be used, are family caregivers. So we wanted to try to figure out, work with them, and also have them in our coalition. We want to kind of change our coalition to have more leading, change leaders. So we want to work with them to try to figure out, ways that we can really help family caregivers make some good decisions about how to spend that money, how to make it spread it out longer, and how to make it the most effective way, because it's only about $36,000. But it's a start. And so that's exciting. And then our tribal program, we want to expand that. We're going to really talk to try to work with, we have a lot of tribes in Washington, and we want to work with at least get 1 or 2 more to try our tribal voucher system.
That's very exciting. That's a lot of exciting things going on.
Yeah, and a lot of them, I just get to go alongside because a lot of the work is done with or without me. But yeah, there's a lot of really, I think they started early in family caregiver support program in Washington a long time ago, like in the 80s. And I always think there must have been a couple of legislators who had a parent or a grandparent who had dementia, and they're, so they knew, oh my gosh, this is so important. So so thank you to them for moving us along so far.
Yeah, and as the only state with a state-run long-term care program now with Washington Cares, we're all going to be looking to you to see how Lifespan and Respite got to the table on that. That's really
well, it's been a bumpy road, I'll tell you.
It's
not been well received by many people, but we know a lot of times we don't want to do what's best for us. So I think at some point people will realize the benefit of that.
Is it more of just a concern about cost, or what are people's objections to it?
They don't believe that, and there's a lot of misinformation out there, and you really see that because I answered their emails for quite a while because they didn't have any staff to do that. So they asked people who work in Alto, can you please help us? Right. And they even gave you, some messages to just include. You didn't have to do it on your own. But a lot of people totally believe that Medicare will pay your long-term care. People totally believe that, and you cannot convince them otherwise. And they just don't think that people should be making that decision for them. Right. But they don't realize that we all pay for that out of our medical taxes, our costs for medical insurance, our costs for medical services. So it's been tough. And then they had some other things that I didn't think were gonna work, but one of the things was they were making people, if you worked in Washington but you lived outside of Washington, you still had to pay that, but you had to move to Washington if you wanted to use it. And I thought, that's not gonna last. There's no way they're gonna be allowed to do that. So they had to take that out, and we had to make it, they had to roll back the time, or roll forward actually the day that they were going to start taking out by about 1.5 years, I think. So
right. No, I certainly understand the objections and the concerns about a long-term care policy, because we had that at the federal level trying to implement the Class Act a few years ago. What I thought you were referring to was difficulty getting it to the table around the respite and caregiver piece of that you're there's no objection around those attempts that made through your Lifespan grant.
We and also we've kind of been through all that with our MAC and DSOA 1115 waiver, because we kind of mirrored that from our family caregiver support program, but it's paid by Medicaid. So we have to go by some of their rules. And so we've kind of dealt with a little bit of that already about, how the person who has to agree to do the program is the care receiver, because it's Medicaid money and they are all about care receivers. But, it's a kind of a very gray area where they are turning the service over basically to their caregiver if they choose to do Macandasoa, because the services, the assessment and all the services benefit the caregiver. But we keep trying to point out that they also directly benefit that care receiver, because a better trained, a calmer, more mentally healthy and physically healthy caregiver is going to be a better caregiver for longer for that care receiver. So it's saving everybody. It's saving money, taxpayer money. So yeah. So
we're actually going to get closed out in about 5 seconds. So
okay.
Go back
Sorry,
to the main
I took so
room.
much time.
Thank you
All
all
right.
for that tremendous sharing. And Sarah, I'm sorry we missed you. We're going to go back into the main room now. Thank you all so much.
Thank you. Bye.
Thank you, Jill.